On Monday, the Board of Selectmen voted in non-opposition, allowing the Massachusetts Patient Foundation to pursue a permit from the Department of Public Health in their quest to open a medical marijuana dispensary in Arlington.
Now we have a request for statement of non-opposition to medical marijuana dispensary from the Massachusetts Patients Foundation.
Several concerns have been voiced, including the Arlington Police Department. Chief Ryan has stated in documents that the potential addition would increase police demand and therefore require 4 more policemen, the operating cost totaling $400,000.
The community benefit agreement speaks to 3% of gross revenue, and the estimates that the applicant has put forth is that could result in anywhere between $200,000 or $500,000 in revenue for the town based on what their sales actually are. So you're absolutely
Annually?
correct. Annually, yes.
yeah.
So on the low end, you're right that would not satisfy.
Okay.
The dispensary would still need an approval from the Department of Public Health and is required to pass the Board of Health's regulations.
The regulations don't really go beyond what the state is requiring. The state's regulations that are already in effect through the Department of Public Health are quite comprehensive and cover, the full spectrum of issues. Our regulations essentially adopt those to a certain extent and allow a mechanism for local oversight and inspection such that we can respond to complaints and conduct inspections as necessary to ensure Arlington's public health and safety. There are a few minor variations, a few things that are covered in the Board of Health regulation that are specific to Arlington that would not be covered in the state's regulation, which pertains directly to medical marijuana, is ensuring that a medical marijuana facility in Arlington is operating solely for that purpose. So it limits convenience co-buys, so you wouldn't be able to also sell alcohol, tobacco, e-cigarettes, lottery places. It currently has a placeholder for placing restrictions on the hours of operation. And I think it also has a requirement for the dispensary to hold an annual community meeting with this local abutters or stakeholders and other people who may have an interest in that business to discuss any concerns and be able to provide feedback.
If the Massachusetts Patient Foundation receives their permit from the Department of Public Health, the next step would be for the Selectmen to approve the community benefit agreement. This is Stephanie Francis for Arlington Public News.